And then the submental, what can I say? A big congratulations to all the team at BTL, because now we're targeting 2 bellies of muscle that I had to go back to the anatomy textbooks because I couldn't remember where they were and what they did from medical school anatomy days. I don't know about you, the digastric muscles, they're skeletal muscles, once again. They're not facial expression muscles. They're skeletal muscles, so no different from us losing 1% of collagen, elastin, hyaluronic acid, and 1% of all of our body's skeletal muscles. We're also going to lose 1% of our digastric muscles, anterior bellies, as we age. And that holds the floor of the mouth tight. So in order to target that muscle and keep it strong, we would have to suck in and hold our breath. So we can't train that either. So how can everyone's doing a bit of that now? So how do we train it? High intensity focused electrical stimulation combined with synchronized radio frequency. And this one is a synchronized radio frequency plus, so very similar. It takes that extended mode, increases the temperature to 45 degrees, so you get a little bit of atrophy of the fat that happens over time, and you get elevation of the muscle into the floor of the mouth. What does that look like? An improvement in the cervical mental angle, and the patient is happy because they have a tight, toned, beautiful looking jawline. Congratulations again to BTL, because we had 7 clinical studies done when the original 𝕒𝕒𝕗𝕒 was launched. And that is a lot for a new device to be launched. And then with EMFACE, we launched with 10 clinical studies. With EMFACE Submentum, another 5 clinical studies. And these are all new coming out. So I'm sure if you ask your team for BTL, you'll be able to get access to all of this. But I ask my patients before they come to these kind of treatments, you're investing in something that is so critical to your longevity, which is the stimulation of muscle. Not just immediately, but the growth of it over the next 3, 6, 9, 12 months. So when I've seen my patients with the results, and I compare them to the preliminary 1-year data that Dr. Yael has in the United States, they're pretty comparable. This is Dr. Halas's patients with 4 treatments, done a week apart, and she's done nothing else to the patient who begged her for a facelift. She did nothing for a year. And the results maintained with a peak of about